Let's be honest, gentlemen. As men, we often like to believe we can handle almost anything. We push through pain, ignore discomfort, and tell ourselves that whatever feels different will eventually disappear. Being strong is important, but there's a difference between being strong and ignoring changes that deserve attention. When it comes to prostate cancer, recognizing certain warning signs can make a major difference. Now, before we continue, understand this clearly. Experiencing one of these symptoms does not automatically mean you have prostate cancer. Many prostate and urinary conditions can cause similar symptoms. Your prostate is a small gland located just below your bladder. It's roughly the size of a walnut and surrounds part of the tube that carries urine out of your body. As men get older, the prostate commonly grows larger. That enlargement can be completely non-cancerous, but it can produce symptoms that overlap with those associated with prostate cancer. This is exactly why ignoring changes or trying to diagnose yourself isn't a good idea. Knowing what to watch for gives you the opportunity to seek medical attention when necessary. Warning sign number 1 is increasing difficulty passing urine or needing to urinate more frequently, especially at night. Maybe you've started waking once, twice, or even several times to use the bathroom. Perhaps your urine stream feels weaker than before, or you have to wait longer for the flow to begin. These changes deserve your attention. The prostate sits directly below the bladder and surrounds part of the urethra, the tube that carries urine out of your body. As the prostate grows larger, it can begin putting pressure on this passage and make urination more difficult. But gentlemen, this is where you need to avoid jumping to conclusions. A common condition called benign prostatic hyperplasia, or BPH, causes the prostate to enlarge as men get older. BPH is not cancer, yet it can cause difficulty urinating, a weaker stream, frequent urination, and repeated nighttime bathroom trips. Prostate cancer can also be associated with urinary changes, which means symptoms alone cannot tell you exactly what is happening. What matters is noticing when your normal pattern changes. If you're suddenly urinating much more frequently, struggling to start, experiencing a weaker flow, or repeatedly waking during the night, don't automatically blame your age. Get evaluated and find out what's causing it. Warning sign number 2 is pain or a burning sensation during urination. If passing urine suddenly becomes painful or uncomfortable, especially when the problem keeps happening, don't simply assume it will disappear. One possible cause is a urinary tract infection, or UTI. Bacteria can infect the urinary system and cause symptoms such as burning, pain, frequent urination, and a strong urge to use the bathroom. In many cases, an infection can be identified and treated, but persistent painful urination can also occur with other problems affecting the prostate or urinary system. That is why the safest approach is to find out what is actually causing the symptom. Maybe the burning started recently and hasn't improved. Perhaps it disappears for a while and keeps returning. Or maybe it occurs together with difficulty passing urine, a weaker stream, or frequent nighttime bathroom trips. Those combinations deserve attention. This doesn't mean you should become frightened every time urination feels uncomfortable. Pain or burning does not automatically mean prostate cancer. The important thing is not allowing an unexplained symptom to continue for weeks or months without getting checked. If painful urination persists or becomes worse, speak with your doctor or urologist. Warning sign number 3 is blood in your urine or semen. Seeing blood can immediately make you worry, but don't panic. At the same time, don't make the mistake of ignoring it because it happened only once. Blood in the urine is called hematuria, while blood in the semen is known as hematospermia. These symptoms can happen when there is irritation or damage somewhere within the urinary or reproductive system. And importantly, seeing blood does not automatically mean prostate cancer. There are other possible causes, which is why you need proper medical evaluation instead of trying to determine the cause yourself. If you notice red, pink, or unusually dark urine, or you see blood mixed with your semen, speak with your doctor or urologist. Even if it disappears afterward, it is still worth mentioning. Pay even closer attention if the bleeding continues or appears together with other changes we've discussed, such as difficulty urinating, frequent nighttime urination, or painful urination. The goal here isn't to frighten you, it's to make sure you don't dismiss a visible change that deserves investigation, because some prostate problems become much more serious when they progress. Now, let's talk about what can happen when prostate cancer spreads beyond the prostate. At this stage, the symptoms may no longer be limited to changes in urination. Cancer cells can move into other parts of the body and begin growing there. One way this can happen is through the lymphatic system. Your body contains lymph vessels and small structures called lymph nodes. These nodes are part of your immune system and help respond to infections, inflammation, and abnormal cells. Prostate cancer can spread from the prostate into nearby lymph nodes in the pelvic region. From there, cancer cells may continue moving to other areas. Another route is through the bloodstream. Once cancer cells enter the blood, they can travel to distant parts of the body and form new cancer deposits. This process is known as metastasis. Prostate cancer can spread to different areas, including the bones, liver, and lungs. The bones are particularly important because advanced prostate cancer commonly spreads there. When this happens, a man may begin noticing symptoms that seem completely unrelated to his prostate. One of the most important is persistent pain. Warning sign number 4 is persistent pain in the lower back, spine, or other bones. This is especially important when prostate cancer has advanced beyond the prostate and spread to the bones. Prostate cancer cells can travel through the bloodstream and settle in bone tissue. When this happens, they can form new cancer deposits known as bone metastases. For some men, one of the first noticeable changes may be ongoing pain around the lower back or lumbar region. Others may experience pain around the middle or upper spine, hips, or other large bones, but don't hear back pain and immediately assume prostate cancer. Back pain is extremely common, especially as we get older. Muscle strain, arthritis, injuries, and many other conditions can cause similar discomfort. What you should pay attention to is pain that feels unusual, persistent, unexplained, or continues getting worse. This becomes even more concerning when it appears together with other changes, such as difficulty urinating, blood in the urine, or other symptoms we've already discussed. Being tough doesn't mean living with unexplained pain for months and hoping it disappears. If something has changed and the pain continues, get it properly evaluated. Warning sign number 5 is unusual swelling in the legs, pelvic region, or scrotum. This can happen when prostate cancer has advanced and begins affecting the lymph nodes in the pelvis. Your lymphatic system normally helps move fluid through your body. When lymph nodes in the pelvic area become enlarged or blocked, that normal drainage can become difficult. Fluid may then begin collecting in nearby tissues. You might notice that one or both legs are becoming swollen, your pelvic area feels unusually full, or your scrotum begins to swell. These are changes you should take seriously, particularly when the swelling appears suddenly, continues getting worse, or occurs together with other warning signs. Of course, swelling can have many causes and does not automatically mean prostate cancer. But unexplained swelling is still something your doctor needs to evaluate. If you experience significant swelling alongside difficulty urinating, blood in your urine, persistent back or bone pain, or other unusual symptoms, seek medical attention rather than waiting for everything to disappear on its own. Gentlemen, taking action when something changes isn't weakness. Being responsible for your health means knowing when it's time to stop waiting and speak with a doctor or urologist. Because when it comes to prostate cancer, finding the disease early can make an enormous difference. So gentlemen, you now know the 5 warning signs that should never be ignored: increasing difficulty urinating or going more frequently, pain or burning during urination, blood in your urine or semen, persistent unexplained bone pain, and unusual swelling in your legs, pelvic region, or scrotum. I'm Dr. Leah, and I want you to leave this video understanding one thing clearly. Having one of these symptoms does not automatically mean you have prostate cancer. An enlarged prostate, urinary infections, and other medical conditions can produce similar changes. The important thing is recognizing when something has changed and getting the proper medical evaluation instead of guessing. Prostate cancer that is discovered while it is still confined to the prostate has a much better outlook than cancer that has already spread to distant parts of the body. That's why you should never allow embarrassment, fear, or the belief that you can simply push through it to stop you from getting checked. Being strong means taking action when your health demands it. Your health matters not only to you, but also to your partner, children, family, and everyone who wants you around for years to come. So if you notice persistent changes, speak with your doctor or urologist. If this video helped you, like, subscribe, and share it with another man. And tell me in the comments, when was the last time you had your prostate health checked?